Welcome back. I see that you aren't trying to hide and you are healing very well. How has your stay been here? It is a really, really fun place, actually. Most people wouldn't think so. So what we're going to do is we're going to do a little bit of talking, okay, and see where you are with everything. And I'm going to get you to stand up in a little bit so I can just do my exam. And well, your room's starting to look really good. Your bathroom's all decorated and good for you. Making it, a little more like home makes it a little more comfortable, for sure. Well, you saw some family today. That's good. That's really good. How are they coping? Yeah, I talked to your aunt that came. Yeah, I talked to her and she said that she's very proud of you, and we all are. You actually have been one of our best patients, and you're so much fun. So, yeah, we're going to do some talking. I'm going to recommend a book for you to read while you're here. And I'll do your blood pressure. And what else can we do? I'm going to be spending some time with you talking about how to deal with your chronic pain in ways that are better for you in the long run, and we'll see if we can get you to cope with that, some of that insomnia. Okay, I have some natural melatonin that might help you, so we'll see. We'll go from there. Okay, so I'll just get you to stand up, and then we will sit back down after in another room, and we're going to do some talking. Does that sound okay? Okay, I'm going to be with you for a little while, so there's no big rush like there normally is with doctors. And no, it's looking really good. Good for you. That is a very, very hard step, and you got to do it. You do have to do it one day at a time. Yeah, one crisis, one emotion at a time. So, yeah. Okay. Yeah, exactly. Okay, so I'll get you to stand up, and we'll go from there. Now, what we're going to do is we're going to do your blood pressure, okay? So, just give me the opposite arm, okay? Right. Perfect, thank you. Okay, ready? Okay, just relax your arm. Just chill. Cool. Can you go for a walk in the courtyard? Yeah. It's nice to get outside. Nice and sunny out too. That's nice. There we go. Sorry, I shouldn't be getting you to talk. Okay, good. Very, 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 very good compared to last time. Yeah, it was a little high, which is totally understandable, right? So I'm just gonna write that down here. pulse has slowed down a little bit. That's really good. Some of those natural meds helping. Okay, good. I mean, the numbers show it all, but depends on how you feel, right? Okay. You want to stay in here and talk? Okay. Okay, that's totally cool. That's totally cool. Bathroom's one of my favorite rooms anyways. So, you know. But if you need anything, just let me know, all right? Perfect. So, I'm going to show you a book. I brought it in earlier. I don't know if you read it. No? Okay. I'm just going to talk you through some of it and show you some of the really good chapters that might just kind of, I guess, help you with your support groups while you're here. If you bring up anything you want to talk about, it's a perfect place to do it. So let's just take a look. Small in here for my wheelchair. There you go. Yeah, my nose bugs me in here too. It's pretty dry. Okay, so this book is The Completion Process. We've all talked about it before here. It's a really important part of our therapy, actually. So on Tuesday, Teal Swan's actually going to be coming in for a workshop. Don't miss that, okay? Oh yeah, she really helps guide, you know. I find a lot of it is stuff we kind of already know, but it's really nice to hear that from somebody else, right? Yeah, it's good for validation, and knowing that somebody else has been through it really helps. So we're going to, just going to read a little bit of it for you, all right? When it comes to suppressed aspects of our being, the first step in shifting from a lower vibration to a higher vibration is becoming aware, which you definitely have, definitely. When we are dealing with something we are not consciously aware of, becoming aware is always the first step towards vibrational growth, which is definitely what we're based on here, you know. Becoming aware is like the first time you shine light into a dark closet to see what's there. Awareness in and of itself generates immense relief. We fear our shadow, and that is why we initially resist. But by becoming aware of it, we come to understand it. Are you okay? Yeah. It's going to bring up some emotions. Understanding our shadow is the most effective way to diminish the fear, which allows us to feel more grounded and authentic. Positive focus does work, but there is one major exception. Positive focus works on everything except for the things you're trying to avoid, which makes perfect sense. Another way of saying this is that positive focus works every time except when it is used as a tool to enable our resistance. And we all know that what we resist persists. Many of us are excited to discover the power of positive focus because it seems like a get out of jail free card. It seems like a magic pill that allows us to escape and avoid all of our unwanted aspects. Unfortunately, because of an incomplete understanding of the law of attraction, many teachers reinforce the idea that all it takes to create a perfect life is perfect positive focus. but there's more to it, right? Oh. I'm gonna check my page for just a second. Sorry, I just gotta check my pager. I gotta make sure there's no emergencies or anything. But don't worry, everything's fine. Okay, we're good. Good to go. Alright. So, you want me to keep reading? Okay, it's only a little bit left, so we'll just might as well get through it. It's actually on your schedule today, and instead of it being reading material for you to bring to the group, we are starting to read to the patients. But you're more than a patient. I'll just tell you that. You are definitely a friend, okay? So, on we go. Yeah, exactly. However, consider this. If we have big things we are trying to avoid, like it or not, and conscious or not, a large part of our consciousness is going to be focused on past traumas. It's okay. You'll get through this. There's no need to feel ashamed, okay? I've been there. Maybe you get to a point where you don't just, it doesn't matter what other people say. Just, everybody has their struggles, and just because you may not see marks on other people's bodies doesn't mean that they're not marked up inside. They just hide it. They don't know how to let it out. Not to say that it is a good coping mechanism, but sometimes it's more of a release than repressing. Yeah, exactly. Anyways, we're like emotional cripples who, on one level, we know we are really hurt, but on another level, don't want to admit it. We'd rather believe that if our focus is positive enough, we will miraculously be put together again. Be put back together again. It's been a while since I've been reading out loud to somebody, so bear with me, alright? Thanks. Here's the flaw in that thinking. The law of attraction, which is governing law of the universe, is essentially the law of mirroring. Mirroring. It's one of those words. The law of attraction states that whatever vibrations are contained within you are being matched exactly by experiences in your external world, which we both know is legit, right? And as we have already discussed, like it or not, your shadow aspects are vibrations within you that are attracting experiences into your life to match them. For this to stop happening, the shadows within you must be integrated and healed in order to cease being points of attraction. So, kind of, I guess, becoming friends with your demons, or I call mine my gremlin. When talking about the law of attraction, Teal often uses the analogy of radio dial. Okay. Whatever station your dial is turned to dictates what signal and therefore what radio station you will receive. On an emotional level, this means if you are tuned to joy, you receive joy. But this analogy only works if you see yourself in your entirety as one dial. You know, that's you coming up with what you really would like to feel and just imagining it. And it's really frustrating, trust me, but it does work with practice. Keep losing my spot. In reality, you are more like a switchboard made up of a multitude of dials. The various frequencies that are being received by all these different dials make up your overall vibration. You have a dial relative to every subject in your life. Looking at it this way, my dial, so Teal's dial, relative to relationships could be set on despair. So I receive relationships that lead only to heartbreak. It's like a continuous signal coming in, you know, just on one frequency. Yes. I have read this. Yeah. No, I have. But I don't remember a lot of it. And I was in a different frame of mind when I read it. So it's making a lot more sense to me now. Where are we here? Simultaneously, my career dial could be set to elation. So I receive career opportunities that make me feel elated, and I love my job. I love my job. And you will get there, okay? You will get there. If you improve the frequency of the signal being received by just one of these dials, your overall vibration increases. But to say that positive focus in any one area of your life will cause positive improvement in all areas of your life, you see how that wouldn't be accurate. It's almost like that expectation, especially of yourself, is incredibly tense, and there's a lot of pressure. And you know what happens with pressure. Yeah, exactly. Regardless of how much you positively focus on your career, on your friends, or on your body, you can still have a terrible vibration about romantic relationships. So you will still experience negativity in your romantic life. You might start to think that positive focus doesn't work. But as I have just described, that's not the full story. Okay, so that is on page 49, and I'll mark it for you. Okay, and that is basically what group's going to be talking to you about today. And it's actually going to be at 3:30 because we're getting ready for the Teal workshop on Tuesday. And we got to set that up in the same room, right? So, yeah. So how you doing? You good? Okay. Did you go for lunch? You had it in your room? Okay. Just try and make sure not to isolate too much, okay? Just every once in a while, even just try to even just say hi to somebody. It'll definitely help you feel less alone. A lot of the people here are going through pretty intense stuff as well. But as you know, this is a very easygoing clinic, okay? And as you see, pictures on the wall here, the little mirrors, you definitely have earned our trust. So we're going to keep those there as a way to show you that out of pain can have something beautiful instead, right? Okay, so what else are we going to do here? Oh yeah, that's right. Okay, so a couple things here. You said you were having a really hard time sleeping. Yeah, okay. Okay, I'm going to keep these in your med cart just outside your room there. And if you need anything, okay, we're just gonna take one a night, and these are all natural, so you don't have to worry about getting hooked on them or anything, okay? And hopefully that'll help you relax and sleep. Because, as you know, we do not provide any harsh chemicals, medications here. So another thing is we have these witch hazel patches, okay? So I'm going to talk to your doctor, okay, or your psychiatrist, I should say. We're going to see if this would be a good fit for you with your pain, because I know chronic pain definitely it doesn't help with depression symptoms, right? Because it's just a day-by-day thing. But I gotta tell you, I actually use these and I can actually do my work without completely just being engulfed with pain, and it's the only thing you can really focus on. It's not fun. Yeah. So we gotta get to group here soon. So what we're gonna do in group is we are going to show a slideshow, okay, about pain and depression. And we are going to give everybody their own headphones so you can listen to a nice relaxing introduction, and hopefully you'll get some coping skills for tonight, and then we'll see how it goes, okay? Yeah, no problem. Okay, well, you take care, and you're doing great, and I'm very proud of you. And you know, at the end of the week we're going to have like a major buffet for you, just to show you that we're very proud of you. Okay, so we're gonna get to group here soon, and yeah, I'll see you there. Okay, cool. Bye.